presentation.
I am going to present the video on an innovative Visco chopper.
Are you able to see the video?
Yes, sir, we can see.
Chamber.
Thank you.
It acts as a two-way function. One, it acts as a chopper and also as a Visco delivery system. So this is applied to the silicon oil port or the vitrectomy port on the console, and the silicon oil system is used for this purpose. Instead of silicon oil, we use Visco, and this is a knob on the foot pedal which is given by the company for activation of this port. You can see the VA port on the console, which is specially made for this purpose by turbo with Appasamy machine. And this is a challenging case, white cataract. The intracapsular pressure is very high, so it is very difficult to perform the CCC in such cases. And as the Visco is delivered as and when necessary, you can make the antrechamber deep, as well as you can see the peripheral extension of CCC can happen at this moment. So we can inject the Visco at this moment and we can avoid this peripheral extension of the CCC. This is the intumescent cataract. We are extracting the liquid cortex from the capsular bag through the tiny opening, and one is injecting one port. Through one port, we are injecting the Visco through a automated Visco delivery system. So we can take out the fluid cortex. At the same time, we can inject the Visco. Now this is the PC rent which has taken place, and to avoid the extension of the PC rent, we can inject the Visco inside the antrechamber through this chopper, so that the antrechamber depth is maintained, IOP is maintained, and the Visco will take care of PC rent and the vitreous. Now this is the small pupil. Again, it is very difficult to perform the CCC, so Visco can be delivered and you can have CCC with ease. This is another case of hypermature cataract challenging situation. Here I used AC maintainer to deliver the Visco. Can maintain the antrechamber, and you can extract the fluid cortex, the liquid cortex, through the main incision or through the extractor. This is another challenging situation where the last piece of the nucleus, while removing you need good AC depth, otherwise PC rent can happen. This is another challenging case of lens-induced glaucoma case. Corneal edema is there, iris is coming out through the wound, lot of IOP pressure in spite of all measures. We have taken anti-glaucoma measures. So this Visco inside the antrechamber can give you protection from the endothelial damage. This is another scleral fixation IOL case where a lot of manipulation is required, and the chances of hypotony is there. So to avoid that, the through AC maintainer Visco is delivered inside the antrechamber and the IOP is well maintained. Pediatric cataract case, the CCC is very difficult because of obvious reasons: elastic capsule, less rigidity, scleral rigidity. So to maintain the IOP and antrechamber depth, Visco is delivered through the AC maintainer. This is a hard cataract, supra hard cataract. Endothelial damage can happen in routine cases, but with the help of Visco, you can avoid that. And this is the manual way of delivering the Visco inside the antrechamber through the Visco chopper. And initially, I showed you the automated technique. So this helps in a complicated cataract cases, phaco cases, to deal with the endothelial damage, to maintain the AC depth. The manipulation are easy and to perform, and the PC rent also can be managed very well, and we can avoid the PC rent in most of the cases. This is the silicon oil system which we have utilized for this purpose, and especially Visco chopper is made by a 26 gauge needle, and the special needle is made by the company. Thank you very much for your patient listening.
Thank you very much, Dr. Santosh, for this innovation. And I'll request Dr. Rashmin Gandhi to ask questions to Dr. Santosh.
Thank you, Dr. Santosh, for that video. And I see that you have quite a few presentation in this Think Under the Apple Tree. So Congratulations for all your innovations. A couple of questions or observations in your automated system where you used the silicon oil system of the Appaswamy. So you press the foot pedal to have a burst of visco. Did I understand it right? That's
Yes.
how it is?
Yes, there is a special knob given by the company. I requested them to have a separate knob. Otherwise, what happened while doing the FACO, you cannot inject the visco. You have to come out from the FACO, then you have to again go to the silicon oil port, activate it, and again pour the visco. So I have asked them or requested them to have a separate knob for that, and they have given that. It is available in now newer machines in Appa.
So can you control how much visco goes in, and does the viscosity and pseudoplasticity of the material affect how much visco will go in? Let's say a dispersive viscoelastic versus a highly coercive viscoelastic. Does it matter when you use that system?
Most of the time I have used HPMC only, 2% HPMC, and the injection of the visco is very slow and it's very less quantity, means maybe 0.05 or 0.1 cc only at one time. So if you press continuously, you will get more visco. So that control is there.
Okay. Yeah, the nice innovation, and I'm sure as you demonstrated also the cases where this can be useful, like PC rent, where you don't have time, you have your hands free to do what you want to do while you press the foot pedal and let the visco go in. Thank you.